Hi, Dr. Boatright. Good afternoon. I'm Esha, a high school student who's interested in being a veterinarian. I'm excited to introduce our speaker today, Dr. Kate Boatright. She has been in small animal practice since graduating from the University of Pennsylvania in 2013. After nearly 8 years of full-time practice in both general practice and emergency clinics, she moved to part-time clinical work to pursue her passion for educating veterinary professionals as a freelance speaker and author. Dr. Boatright enjoys discussing mentorship, the unique challenges facing recent graduates, wellness, and the spectrum of care. She's the author of the Veterinary Mentorship Manual, a resource for practices to help guide them in developing solid mentorship programs to support new graduates. She believes deeply in the role of organized veterinary medicine and holds leadership positions in the AVMA and her local and state VMAs. In her remaining time, she stays busy chasing her toddler, running, reading, and watching movies with her husband and cats. I'm thrilled to welcome Dr. Boatright to the interview series on the careers of veterinarians. Thank you so much for chatting with me today.
Thanks. It's great to be here.
So could you first tell us about your work, and feel free to show any pictures or slides if you want.
Yeah, so I have my hand in a little bit of everything. So I have a few different hats that I wear. So I mostly am a small animal veterinarian. So I went straight into general practice after graduating, and I currently work part-time at Penn, Ohio Veterinary Services as a small animal clinician. I'm in the clinic about 3 days a week. I also, for a while, about 5 years, I worked in a clinic that did both general practice and emergency medicine. And I really loved emergency, but it just got to be a lot with the pandemic and my having a child. And so I had moved back strictly to general practice, but after about a year, realized how much I missed it. So I still pick up like one shift a month at a local specialty emergency hospital just to keep my hands in it. But my particular areas of interest in the clinic are soft tissue surgery, feline medicine, emergency, and then endocrine diseases. So diabetes, Cushing's disease, Addison's disease are particular interests of mine. So these are just some of the pictures of kind of daily life in the clinic. And the bottom right corner there is us doing an emergency procedure on a cat that was having trouble breathing. So we're removing excess fluid from its chest, called a thoracocentesis. The surgery picture is from a foreign body removal. My day definitely varies in the clinic depending on what's on the schedule. And I see everything from vaccine appointments, like that adorable litter of puppies, to sick appointments. I diagnose, everything from, emergency conditions like foreign bodies to, more chronic diseases like diabetes, cancer, and then we work with the clients to manage them. Sometimes we're getting specialists involved, and sometimes we're keeping the primary management in our own clinic. One of the things I really love about general practice is that long-term relationship that you can really build with clients. So on the bottom of the screen, you can see one of our patients. He's a Maine Coon. And when he was 12 weeks old, and then again when he's 15 months old. So as we've been able to watch him, grow, and he's just a super, super handsome giant cat. So a lot of fun there. And then, as I said, surgery and emergency medicine are definitely loves of mine. So these are some kind of emergency procedures that I've done. So C-sections are always really rewarding. So you can see one of the mamas and litters of puppies that we delivered. The middle picture there is of a pyometra. So that is an emergency that we see in older females where they get an infected uterus. And so the treatment is to spay them on emergency. So you can see the big distended uterus there. That upper picture is a collection of material that we removed from a dog's stomach. It was all out of the same dog. And then some of the bladder stones that we've removed, those would be some of the larger ones that I've done. You can see the marker there for comparison. So I do everything from spays and neuters to those emergency procedures, do lump removals. Pretty much if it's soft tissue surgery, I'm usually willing to give it a try. I do stay away from broken bones and orthopedics. That's just not my cup of tea. But I also have a very active professional life outside of the clinic. And so about 5 years ago, I started speaking and writing. So currently I travel around the country as well as do webinars for both veterinary professionals and students. And so I've been really fortunate to be able to be at a number of conferences this year. One of my goals is to get to all of the veterinary schools to speak in person. So I'm getting to Kansas State in person this semester. Unfortunately, and then I have some virtual ones. Unfortunately, I'm not able to get to too many places this semester, but I've been to about 9 schools in person and a number of others virtually. And I have a variety of different lectures that I give, but some of my favorite topics, again, are mentorship and the spectrum of care. So the spectrum of care is the idea that there is not just one right way to treat a patient. And there's really a range of options ranging from kind of our traditional gold standard to less invasive and expensive procedures. And so it's really that range and just talking to students and making them aware of that, because that's unfortunately not always how we're taught. There's a growing movement in a lot of schools to start teaching more of kind of real world medicine. But it is something that I really enjoy discussing and educating different professionals on. And then I also, in my freelance work, I am an author. I write for numerous veterinary magazines and blogs. I started out writing like article summaries and lecture summaries for a magazine called American Veterinarian, which no longer exists. I now do those types of articles for DVM 360. But I also write a lot of my own material on a variety of topics, from best ways to utilize the team, mentorship, spectrum of care, talking to clients about finances. So a wide variety there. And then I wrote a book called the Veterinary Mentorship Manual that I self-published earlier this year. And it has just been really awesome to kind of connect with other veterinarians and help support practices as they try to support early career veterinarians. As I said, I love mentorship, and I have been working with prevet and veterinary students since I was in vet school. And I've been fortunate to also be able to work with early career veterinarians in the clinic and also remotely. There's a great number of opportunities now that for mentorship through virtual options. Like in programs, there's one called Mentor Vet that is that I mentor with. And I've done a couple of other programs like that where I'm able to support people from a distance. And then I've also recently started doing some consulting with veterinary practices on helping them develop their mentorship programs. And then I do believe in giving back to the profession. And so I do have a number of leadership positions. I am the alternate delegate to the American Veterinary Medical Association. So that's the AVMA for Pennsylvania. And we meet in person twice a year. There are 2 representatives from every state and Puerto Rico. And then there are a number of what we call allied associations. So like the American Association of Feline Practitioners, the American Association of Bovine Practitioners, and a number of others who also have representatives. And we discuss some of the policies that the AVMA puts out and vote on them and have a number of other discussions about kind of issues that are facing the profession and how we want to respond to them. I also have a similar role on our state board of trustees. I was previously a regional representative for the Northwest Pennsylvania region. Now I just have a seat as part of my work as the alternate delegate. I also work with a local organization in Northwest Pennsylvania, where I help plan continuing education events and provide education for our members, veterinarians and technicians in the area. I work on the state magazine as an editor. And then I've also, when I was in vet school, was very involved in an organization called the Veterinary Business Management Association, or VMA. And a few years ago, we started an alumni branch of that organization. And so I was part of the founding group of people to get that started. And I am no longer in the leadership of that organization, just because there's only so much time in the day, and I wanted to make room for some new blood in that leadership, but I'm still a proud alumni member of the VMA. And then I think it's important to remember that there is a life outside of the professional world. And so I do have a preschooler now, and I've been very fortunate to have a lot of support from family and friends, which has allowed me to continue to do the travel that I do for speaking, to hold these volunteer positions, and to stay active in my veterinary community. So these are just some pictures. When my son was an infant, the Wild West Vet Show in Reno was his very first veterinary conference at 10 weeks old. My mom and I flew across the country while I was still on maternity leave, so I could go speak at this conference. And so he attended that. He's attended a number of other veterinary conferences and vet schools. I leave him at home now because he's a little more active, so he doesn't travel with me as much anymore, but still, enjoy spending our time at home when we are together. And then I also, have a number of hobbies. So I got into running a few years ago. I'm actually training for my third half marathon right now, and also really enjoy reading. I do mostly audiobooks at this point, because I with my commute and with traveling, that's kind of the easiest way to keep up with books. I enjoy gardening. Can't keep a plant indoors alive, but outdoors I do pretty well. And then just watching movies, spending time with my family. Have two cats who have been with us since we were when I was in vet school, and have just really enjoyed kind of building that life that really integrates both the professional and the personal.
Yeah, definitely. That's incredible. Thank you so much for discussing about all of the different types of work that you do. It's very interesting and amazing what you're able to accomplish while following your passion. Could you tell us about your education, training, and career evolution?
Yeah, so I went to undergrad at a small college in Northeast Ohio, Hiram College. I spent quite a bit of my time when I wasn't in the classroom, either in research labs, which really helped kind of, I think, give my vet school application a little bit of extra strength. And then I also spent time shadowing at two local clinics. One was an equine specific clinic, and then one was a small animal general practice, to get kind of my veterinary hours in. And so I graduated from Hiram in 2009. My major was neuroscience, which was essentially like a psychology and biology double major. And then I had a minor in writing. And I went straight from undergrad into vet school. So I attended the University of Pennsylvania, and I graduated from there in 2013. And as I said earlier, I went straight into general practice. I didn't do any kind of internship. I was really fortunate to have just really great mentorship support in my first practice, which was in central Pennsylvania. And one of the biggest things in keeping up in veterinary medicine is attending continuing education. And so in Pennsylvania, we're required to obtain 30 hours of continuing education every 2 years. I'm jokingly called a CE junkie. I really enjoy going to lectures and conferences, so I tend to well exceed the minimum requirement every year. But I love learning. Sometimes I'm listening to webinars and things during my commutes instead of my audiobooks, just trying to keep up with, all of the amazing things that, that we're able to do in this profession. And I mean, my career has definitely shifted over time. When I started vet school back in 2009, I wanted to be a board certified surgeon. I was going to do an internship and a residency. And I got a couple of years into school and realized that I just wanted to get out and get working. I didn't want to go through the rigorous internship residency path. And so kind of shifted and decided to go straight into just general practice. In 2011, I was selected as the National Vice President of the Veterinary Business Management Association, or VMA. And that organization and my involvement in it has been a huge influence on the trajectory of my career. The people I met are still close friends, and I've stayed in touch with them. Some of them I'm closer in touch with than many of my vet school classmates. And some of the people in the profession that I met during that time have been great mentors for me and really helped as I've started to branch out and tackle other things in the profession. So I started practice in 2013 in general practice, and then in 2016 added in ER medicine. 2018 was the year, it was about 5 years out of school when we added a new graduate veterinarian, and it was the first time that I was the primary mentor for a young veterinarian. And it brought me so much joy to be able to teach and help her develop. And so it kind of opened up like a whole nother side of the career to me. And that was when I decided to start with my freelance writing and speaking. I went to the AVMA National Convention in Denver that year, and I, had just decided I wanted to do it. And so I walked around the exhibit hall and I talked to people, and I'm like, I'm interested in writing and speaking. And they'd ask me, okay, well, what do you want to write and speak about? I'm like, I didn't think that far ahead. I just want to do it. But out of that conference and some of the connections that I made, that really was the launching point for the freelance work that I do now. My son joined us in 2019, obviously shortly before the pandemic. And in mid 2020, I realized that I was experiencing professional burnout. And that's something that a lot of veterinarians and veterinary technicians experience. And it's something that we're talking about more in the profession. But, I like to share that, I did have that experience and I worked through it. And sometimes I'm still working through it. But in that experience was kind of what led me to really reevaluate all the things that I was doing and try to find a little better balance. And so the next year I went part-time and founded an LLC to kind of coordinate all of the freelance work that I did. And 2 years later, I published my mentorship manual and added consulting to the services that I offer. And I actually kind of came full circle with the speaking, in that the AVMA convention was back in Denver this year. So 5 years later, and I went from walking around the exhibit hall saying I wanted to speak to giving 6 hours of lecture at the conference. So that's kind of how my career has evolved, and I'm still fairly early in my career. So, there's a lot of time to kind of continue seeing how that evolution goes.
Thank you so much for sharing about your journey. That was a very incredible journey. You have so many remarkable things that you've done, and you've helped so many animals and people, and I think that's really incredible. So how do you believe that the profession has changed during the span of your career, and how have you and other successful professionals adapted to this?
Yeah, so I mean, there's certainly, I've been out in practice now about 10 years, and there's been a lot of shifts. I definitely think that one of the big shifts that we've seen is a much more broader awareness of the mental health challenges of veterinarians. It really was around shortly after I graduated school. There was a very well-known veterinary behaviorist, Dr. Sophia Yin, who died by suicide. And that really shocked the profession. And from after that, there was a lot of ongoing, there was a lot of research that was started. There are a lot of mental health initiatives that have been started. And so, I mean, there's still a long way to go. But I think the fact that we have that growing awareness and acceptance, that there's not as much of a stigma around mental health challenges as there once were. And I'm really encouraged to see that. Another, major shift that we've seen, especially over the last few years, is just a much bigger discussion about DEI, diversity, equity, inclusion, especially with the cultural things that we've been seeing. There's a much greater discussion about the fact that unfortunately veterinary medicine is one of the least diverse professions out there. And so there's a lot of movement and fantastic organizations working to change that, and raise awareness of veterinary medicine as a career opportunity, especially in those of underrepresented backgrounds. And there's a lot of new organizations that have popped up, like the Multicultural Veterinary Medical Association, and a number of others. I don't want to start listing them because I know I'm going to leave people out. But it's really been fantastic to watch that. Growing up, my mom, who's a minister, was very active in racial reconciliation work in our community. And so I kind of grew up with diversity at the forefront of my awareness. And so to kind of see that evolution in my own profession it's been really good. And then I think one of the other big things that has changed is what we've seen coming out of the pandemic. There's been a shift in the kind of boundary setting, where it used to be that, we just kept piling patients in as much as we could. And I think people have kind of come to that awareness that we can't practice good medicine if we are overloading ourselves every day. And so, I don't know what the right solution is, because there certainly are, problems and areas now where there is even more of a limitation to veterinary care access because of emergency clinics closing or not offering services, or general practices that are reducing their hours. And it's a combination of factors that include staffing shortages, veterinarian shortages. I think that, there are a lot of people working on solutions, and I do still think that there's a very positive future for the profession. But I would say that those are kind of some of the big trends that I've seen in the profession through the last 10 years.
Yeah, thanks for sharing that. Those are some very important and great points that you made. So next, could you tell me about the most rewarding aspect of your career?
Yeah, so I mean, there's a lot of things that that I love about the veterinary profession. I think one of the, for me, one of the things that's been really rewarding, and especially as I've started doing more of the speaking and writing, has been just the strength of the professional community. And the number of people I've met around the country and around the world, who do love this profession, and want to see it continue to thrive and continue to be a good profession for people to enter. And so just the friendships and the relationships I've built professionally has been probably one of the highlights of my career. But I've also built relationships with clients. And having, like I said, having those long-term relationships with clients can be really rewarding. I was at one clinic for 5 years. And when I left that clinic, there were a lot of long-term clients that, I had to say goodbye to. And that was hard. But I'm building new relationships at the clinic where I am now. Um, and, finding, those clients and patients that you can kind of watch as as their family develops, as their pets grow, and really build those deep bonds with. I enjoy a challenge, which I think is part of why I really like emergency and some of those internal medicine cases. And so, I like when I can, have that challenge. I get a little bored if I have a day that's pretty heavy on like vaccines and itchy dogs and things like that. But I get much more excited when I have those challenging cases to keep my brain engaged. And then I've really loved the fact that we can just keep developing and we can keep adding new skills and we can keep growing in the medical services that we offer. And then sharing that knowledge with other professionals. And that's a big part of why I do what I do. Is continuing to learn and develop myself, but also helping others to do the same.
Yeah, definitely. That was very inspiring. So what do you think are some of the common mistakes that you see pre-vet or veterinary students make?
Yeah, so I think one of the mistakes I see is getting too focused on the veterinary career. And yes, it's competitive. It's hard to get into school as a pre-vet student, but you don't want to spend your whole pre-vet life just focused on being a veterinarian. It's important for longevity in the profession to build up those other hobbies and interests, and make sure that you're finding a balance. And the earlier you start to learn those skills, the more successful you're going to be as a veterinarian. And just being aware of those mental health challenges. And then I think the other mistake I see is, not always being comfortable kind of putting yourself out there, and starting to build a professional network. Going to conferences, there's a lot of conferences that have discounted or free attendance registration for students. And I wish I had taken more advantage of it as a veterinary student. And being able to, one, to travel, but two, to get to know other people, and really finding out and exploring all of the different career paths that are out there.
Yeah, those are some very great tips. Thank you. And my last question is, what do you think are some of the common mistakes that early career veterinarians make?
Yeah, so I think, similarly to what I mentioned with the pre-vet and vet students, I think getting too overly focused on the clinic and on your career can certainly be detrimental. Early career veterinarians are one of the groups that have some of the highest risk of mental health struggles and what they call serious psychological distress and burnout. And so, definitely staying aware of that, and being willing to ask for help and just being able to recognize, if you are struggling, or if you have a colleague that you see is struggling, being able to recognize and having that comfort level, to speak up about it, and ask for help. And I think that, one of the things that makes veterinarians successful, especially in their early career time, is having good mentorship. And so I think sometimes we don't ask enough questions about what that mentorship is going to look like in the clinic, before we jump in. I was very lucky in my first clinic and had fabulous mentorship. But I left that clinic after a year because my husband and I were living 3 hours apart at the time, and it wasn't going to be sustainable long term. To be able to have a family, and we wanted to spend more time together. And so, the second clinic I found, I didn't realize how much mentorship I still needed at that point when you're out of school. And I didn't realize it until I didn't have it. And so, I think making sure that that we are asking the right questions about what mentorship looks like, and really defining it before we're entering the clinic is going to help both support, professional development, as well as, just finding that balance between personal and professional life, and being able to keep people in the career for a long time.
Yes, that's very important advice. Well, thank you so much for chatting with me today and sharing your experience and insights as a veterinarian educator and mentor. It's so inspiring to hear you talk about your career journey helping animals and veterinarians, and I wish you continued success in your career.
Thanks.